I refer to him as one of the people's leaders really because of his communication. As I mentioned a bit earlier, but it's just straightforward. He listens well, but he always asks the right questions. He's available all the time for any of the members or for any people that need to get in touch with him. He's not afraid to take on challenge, not afraid to ask the hard questions, and not afraid to implement change when there may be significant barriers. But if he knows that's the right thing to do for the division, for the hospital, for the patients, then he makes it happen. So the RAPSR project is the Rapid Standardized Operating Room, and this took a step back from that was when we decided to try to standardize some of the equipment that we use in the operating room for various procedures. And it sounds very simple. It sounds like, well, why isn't that done before? But it actually wasn't. And so that was the first step. And then we realized that we'd be able to do, with a standardized set of instruments, the same procedure, do that multiple times in a day, and that we'd actually be able to do more procedures within the same amount of time. So better access for patients, and then also cheaper for the hospital to do this. That was an initiative that was led by Dr. Leslie and required multiple disciplines to really make this come to fruition. And again, it really was with the vision that he has, following through with that vision and the way he's communicated it and got the engagement from everybody. That's been a success. He's really sort of the what we call in medicine sort of the triple threat. So he's a phenomenal clinician. He still is and will be one of the go-to clinical surgeons at LHSC. And as a surgeon, that's probably one of the biggest compliments you can give somebody. So clinically, he's there. The second thing would be from an academic point of view. He's really restructured and changed the whole way that our division has functioned from an academic point of view, and we're extremely strong because of that. And then from an administrative point of view, he's shown his prowess and how good he is as an administrator and a leader of our division. We've made huge strides in the last 5 years. He's done so much for our division, for the hospital, for the Department of Surgery. And again, like all good leaders, he doesn't do this for any of the accolades or for any of the limelight. He does it all behind the scenes. And it's just about time that he gets recognized for everything that he's done. I think it's also extra special that Dr. Leslie is winning this award given his history with Dr. Trotty. As many people know, they were very close. In fact, Dr. Trotty and Dr. Leslie were partners. I know that Murray would be extremely proud of Ken for winning this award, as we all are.